Welcome back to the SCG Health Fantasy Draft for 2018 and your MIPS measures. So as you're putting together your team, these are our videos to talk about our measures in a slightly different context, a little bit of football thrown in since it is fantasy season. I'm number 4 at our fantasy measure draft for MIPS, the merit-based incentive payment system. I am Jennifer Searfoss, the CEO of SCG Health, and you are?
I am Gina Clegg.
And so if you see the Help Me Gina, this is the Gina who's going to be helping you with your MIPS questions at SCG Health. But this video, these are a series of videos, we're going to talk about the fantasy draft that we would have if we were going to have our players of MIPS measures. So we're going to start off, and the first one that we're going to be talking about is our big playmakers. These are ones, again, in the fantasy concept, you're looking for players that have a great deal of points, you can count on them week after week on your fantasy team. So if we were building a fantasy team of MIPS measures, what would those be? So starting out, Gina, what would be your top pick if you were looking to do a draft? Who would be your top MIPS measure that you would draft?
I would say probably measure 130, which would be documentation of current medication.
Now, why is that?
Well, number one, it's a high priority measure, so it gives you a bonus point.
Oh, we're not calling them bonus points. We're calling them extra points. Why? Because we're going to put them through. Yes, absolutely football, and we got all confused with the bonus. So it gives you an extra point because it's a high priority measure. But what else about it?
Well, and it's documentation of current medication. If you're not doing it, there's something wrong with you as a clinician.
Absolutely, and we actually had some feedback from CMS saying that every clinician in the United States really should be documenting medications current and prior, making sure and doing that medication reconciliation with the patient. If you're not doing that, honestly, CMS really feels that that's not quality medicine. So documentation current medications also is an ACQM, which means that the majority of electronic medical records have it integrated, and it is a separate measure. It's not the promoting interoperability, formerly known as, advancing care information, formerly known as meaningful use. It's not medication reconciliation. It is a separate measure. But if you were on the transition measure set for promoting interoperability, you actually could get essentially 2 points as long as you click all the right buttons for doing the same thing, right? So an opportunity for folks. So definitely a big playmaker since it is all across the field. Again, using our sports parable here. All right, so what else would you choose if you're looking at your top, your top team, your top players?
So then we're going to go with measure 128, which would be your body mass index.
All right, so your BMI. Now, what's interesting about that one is it's a process of collecting the BMI, which can be done by staff, right? It has to be done by staff. Don't take my word for how tall I am, because I'm 5'6" in my head. I'm also 25 pounds lighter. So my BMI in my body concept is very different than reality. So don't trust folks. You have to do it on the specification. It says it, a professional in the office, either the clinician or a member of the staff has to actually take the BMI. But what's the significant part? That it's not just taking the BMI. What do you have to do?
You have to document a follow-up. For us bigger girls, sometimes we don't exactly comprehend that we are bigger girls and that, we need a little push with follow-up with me. Make sure that I'm watching what I'm eating and, document that.
Right, so it could be a documentation of a referral over to a nutrition center, the actual fact that you gave nutrition counseling, exercise counseling, could also be a referral over to maybe a physical therapist or someone else. If that's documented in the medical record, that's going to be your follow-up. Now, if this measure, which also is available in an EMR, if you're doing it in EMR, what's the notes about using the EMR appropriately so it can capture the follow-up?
One of the biggest things then is just documenting that, referred patient to.
Right, so it's either going to be an order that you're doing in the system, or there may be a separate button that has to be done. For example, we know working with Athena Health in the vitals area, there's actually a separate section for where that follow-up has to be put. It can't just be in the note. So that's one of the interesting things when we start looking at the data, is really where the data is captured is going to be how you meet or exceed the measures. So let's look at a third one. Again, if you're looking for your special team, this draft team that's going to get you all the way through your MIPS and possibly get you an incentive payment, what else is going to be on that team as a big playmaker?
Measure 317, which is going to be your blood pressure.
All right, so this is a new one for us. This is the first year we've really brought this in, and I know that we've had a great deal of controversy when we start talking to our clinicians. there's a big discussion on whether or not blood pressure, taking that for specialists, is related to their medical services. I'd say today, and this is again my own personal opinion, but as Americans, trust me, I'm addicted to junk food. So I think doing blood pressure and checking that is a really big deal. Also, I mean, my father already had a heart attack. My family has a huge background with hypertension, and so double checking that for me when I may only be going in to see a doctor once, twice a year is really a big deal to catch that early, because in my 40s it's a really important time to catch it. So tell me more about the blood pressure screening MIPS measure 317.
This is going to actually be a preventive service screening because you are monitoring for that high blood pressure.
Right, and so this is different than the outcomes measure, which is controlling blood pressure. We don't have that one right now as one of our big playmakers because, again, this is we're really just focusing on that initial measure set. But again, if you're reporting 317, it is kind of like the BMI where there has to be a follow-up. So if you find a hypertensive patient, you can't just say, I'm done. What do you have to do on your follow-up?
Well, follow-up, send them to their PCP.
Right, so do that referral back to primary care or to cardiology so that they can go ahead and be worked up. Now, the big thing, and I won't lie, I'm very upset. I am now in America considered hypertensive, right? Because my latest blood pressure was 131/80. So know that they did change the specifications. And so that's going to be one of the big changes there. This also is incorporated into the electronic medical records, so it is what's called an ECQM, an electronic clinical quality measure. And again, you may run into the same thing of trying to figure out where exactly to put the follow-up information. So each EMR is a little different. All right, so let's round out our big playmakers. What's your last pick?
That would be tobacco cessation.
Well, and I know it's the last pick, and we had a little conversation when we were picking our top 4. What happened and why did measure 226, tobacco screening and cessation, why did that change for you? Why is it number 4 on your pick list?
It is now, so in previous years you actually got credit for your non-smokers.
Which is great, because America's really turned around and really, stepped up non-smoking.
Right. So now the biggest part of this measure is documenting your smokers and documenting that you are educating them on quitting.
Right, so they have to have the cessation. So the way that they've redone this measure, they have what's called 3 strata. So within one measure, you're actually reporting 3 different measures. Your total population, which includes your non-smokers, but strata 2, which is your smokers that received cessation. And that is actually, strata 2 is all that CMS is going to care about. That's where the benchmark is going to be hitting. So it's going to be really, really interesting to see how this goes. And we've already seen a number of our practices and clients have gone down on their performance because they were not aware of that early in the year. So it's one definitely to be monitoring. And so then the third strata is, again, just sort of a general aspect. But strata 2 is the one that matters on that one. So that closes out our big playmakers. So stay tuned for the next video. And apparently I'm just going to cough. Now, there's going to be a whole blooper series that we're doing. So right now, you can be part of our blooper.